Therapist directories. My name is Vanessa Lech. I'm a licensed clinical social worker in the state of North Carolina, and yesterday I happened to be doing some research on therapist directories, and I decided to look up therapists based upon different criteria such as insurances. And one of the things I noticed was that my insurance, which is Tricare, does not surprise me but still kind of did sadly, is underrepresented in these directories, meaning that the licensed mental health clinicians in the directories are not working with Tricare. and for example, in my area, I think it was like a 50-mile radius, approximately 500 therapists showed up. And of those 500, when you selected the criteria of Tricare, it went down to just 9 licensed mental health clinicians therapists in my area showed up. And so what that indicates to me, and I did it in several different therapist directories, is that there's a dearth of licensed mental health clinicians in the Tricare network, which caters to the military community, spouses and family members primarily, and then retirees as well, because active duty service members are pretty much required. Some may disagree with the statement, but pretty much required. I know I was. I know my family member has been, to go on post for services. Sometimes this can be a benefit and a good thing depending upon the quality of the services, and sometimes that can be extremely detrimental, especially for things like mental health in particular, because choice is really paramount in something like that, and the government does not have a very good track record of supporting choice and privacy and things like that when it comes to mental health for the military community, and specifically their service members. Licensed clinical social worker, as I stated, and in North Carolina, and about, I don't know, I think it was a few years ago, I tried to get in network with Tricare, my own insurance company, and I was told that Prime, I couldn't get into it, and that I'd have to go with Select. And basically the difference between Prime and Select are 2 different plans underneath the same umbrella, and a lot of the people I wanted to work with would have been involved in Prime coverage, not Select. And so this was not something I was happy about. I was with Select just briefly, and I eventually just said forget it. Decided to not continue on with it. Quite frankly, would have had a real issue figuring out how to even bill them, because these insurance companies, all of them, are not user friendly, and they really need to be that way so that people can actually obtain the benefits that they have earned, whether it be through their work or their money payment or whatever the case may be. But right now, with Veterans Health Administration, my book Veterans Fears was War Retaliation, talk about that topic. There's pending legislation about possibly veterans like myself that are eligible for VA healthcare being able to choose to opt out and choose where they get their healthcare elsewhere. That'd be really awesome. And if that happens, the option on the table right now is Tricare. I think it's Tricare Select, if I'm not mistaken. I will link below this video the pending legislation when I get to it. Anyways, and right now the network is not sufficient. And they try to say, like Tricare did a number of years ago, that, there's plenty of people in network. There's not. In any of the specialties, especially mental health care. And it's not that there's a lack of mental health care clinicians willing to be in network. It's just that they don't want to include them. And then when they do include these clinicians, regardless of specialty, they're very difficult to work with, which is why you have people paying out of pocket a fortune to get certain specialized services because of a lack of coverage. From high quality providers that don't want to deal with the drama, and I can't blame them one bit. I had to drive 100 miles just recently in the last, I forget how many months, one way to get to a certain type of healthcare provider that was in network with my insurance, and that was worth a darn. And that is just an example of how extreme the situation is with some of these insurances like Tricare. And I see other insurances like Optum and United Healthcare and Aetna and Cigna see that their members get access to all these great, clinicians, and Tricare beneficiaries do not. We don't have that level of access to healthcare, and it is just a complete shame. And that really needs to change.